I approached the CMHT with view of changing my ADHD medication, and I was made an appointment fairly quickly, to be fair. I went to speak to my psychiatrist, asked him about alternative ADHD medication. He said to me, well, it seems that you've tried all of them. Maybe you should look at antidepressants, to which I said, no, I'm not taking antidepressants. That's not my issue. I need medication to manage my ADHD, which means I'll then be able to manage my emotions. I then pushed him and asked him about lisdexamfetamines as an option, to which he said, yes, we can try you on that if you'd like to. I went through several months of trialing different dosages with the same psychiatrist, kept in contact every couple of weeks. That was great. The medication works better than my previous one. So I was happy with that. That was a positive experience. He was fairly, not generous, but he worked with me. He didn't say, no, you can't do this, or it has to be like this. He was fairly flexible with it, but he would always also tell me what he thinks should be done as well. So that was a good positive experience on that side of things. I asked for therapy. I was told that an invitation would be sent out to me about an online course, which I didn't receive. I then got advised that I'd been discharged as I'd missed an appointment, and also missed my therapy sessions. And to my knowledge, I rearranged that appointment on the day, a little bit late, but I'd made contact and made sure that it had been rearranged. And I never received the invitation for the therapy. So less than positive on that side of things. And being just cut off is awful, really. I then went to my GP and said, look, can you push back on this, because this can't be right. I can't just be struck off like this, surely. And they did right back, and I got the same response back again. Well, the only option that I have now is to go private, which in all honesty was going to be the only option anyway, because there's no specialist care within the NHS mental health services. It's just generalised knowledge from the psychiatrist. It's never going to be providing the help that's needed to more complicated mental health problems or neurodevelopmental problems like ADHD, like borderline personality disorder. Also, to add on to this, I'm wondering if I have autism combined with my ADHD. But of course, I have no way of knowing or going to get help to see if that can be diagnosed now, unless I pay for it. So my main 2 points that I'd want to give as feedback would be, getting medication on NHS is easy, which is fine. That's good. It's a good first step. Getting therapy is next to impossible, and that is completely the wrong way around. If you have the correct therapy for your mental health condition, you're less likely to need the medication. And my second point would be having psychiatrists as the only port of call, which then provide a general knowledge across all of the mental health problems, doesn't work. It should be a case of you go to him like you would a GP. He then refers you to a specialist who deals with that mental health problem, especially with things like borderline personality disorder, ADHD, although that's not technically something that you get therapy for. These require specialist knowledge, as could be seen by my psychiatrist's reaction. So, oh, have some antidepressants. Why? How would that help somebody with ADHD? That's not how it works. I don't want to have to say that somebody with ADHD needs to be reminded like that and called and stuff like that, because I hate putting burdens on other people and shifting responsibility away from yourself, but we do need it. We need extra care, extra reminders. We do. It's in our nature. ADHD affects your short-term memory, so of course you're going to forget appointments. I've been offered group therapy, DBT, CBT before, on a couple of occasions, but the waiting times has been 6 to 9 months on occasion. So, which is just an insane amount of times I have to wait. Because once you've got to the point where you've actually gone to the community mental health team for help, that's for me at least, and I think certainly as a man as well, you have to have got to quite a bad point to have finally made that step. When I asked about one-on-one therapy for borderline personality disorder, which is really what I've wanted for years, because you need that if you have borderline personality to build trust and rapport with the person that you're speaking with, so that you can actually speak freely and properly about your history and the things that you need therapy with. And I was told that it just simply wasn't available, which again is heartbreaking, because it's something that I need. So like, I can't build proper meaningful relationships with people without it. I've wanted to get help with borderline personality disorder since I first contacted the community mental health team when I was 25, because I've made 2 almost very successful attempts on my life in that time. I now have a daughter who's 8 years old, and I don't want to end up in that position again, where I feel like that's the only way to stop feeling the way I do. And I'd like to think that my life's worth more than that, and that I should be able to get that help. I'm grateful for the fact that we have mental health services at all, and that there are many amazing people who work for the NHS mental health team, which cannot be an easy job. I never would be able to. I can't deal with people with mental health problems. They're a nightmare. So there are so many amazing people out there that are held back by underfunding, presumably poor management. And I don't want this feedback to be entirely negative, because my experience wasn't entirely negative. I got the help I need with the medication that I need for my ADHD, which is the best medication that I've had for it so far, and allows me to function as almost as an actual productive human being, as a member of society most days. So I'm grateful for that and thankful for it. It's just a shame that the way it ended, and it is currently.